for.
Okay.
Number one, you give an infiltration injection to number 3 in English. And you give the injection, and 2 seconds after you give the injection, the patient goes, I can't see through my right eye.
Oh, okay.
I'm blind.
Okay, well, yeah, no, I'm terrified because I didn't know that was on the table.
Yeah, that's on the table.
Actual
like you can
blindness?
inject here, and it travels up, hits the optic nerve, and
hits the optic nerve.
Okay, maybe not.
You are way too bloody deep, sir.
No, I have. Something happens.
Are you asking for a friend, or did this happen to you? What did you do? Did you pierce into their brain?
This happen. No, I've heard it can happen. It's very rare.
Can I modify this to what is actually on the table? Yes. Okay, you can get some of the nerves that are supplying the musculature around the eye, and it could become hard for them to actually close their eye, and you might have to put a little patch there, or they're going to dry out. That I have inadvertently had happen, and I'm sure I'm not the.
Eye stays open.
Eye stays open. You pretty much paralyzed the.
I haven't heard that.
Muscle versus sensory.
Is that possible?
That is possible, but the blindness, it happened to me.
That a patient couldn't close their eye?
They couldn't close their eye for the duration of the anesthetic. Yeah, it's terrifying. You feel like a real major asshole.
I have heard people who've given injections and they can't see.
Can't see. I think that...
they have temporary blindness.
Okay, temporary blindness, you hitting an optic nerve. I don't buy any of this shit. I'm going to need Sean or somebody's going to need to fact check this, because now I'm terrified that that's even on the table.
Okay. What about,
this is my number one. If this is what it is, number one.
Okay.
The mediocre dentist. The mediocre dentist. 'Cause sometimes you just feel mediocre. The mediocre dentist. The mediocre dentist. I am mediocre. You are mediocre. And that's not that bad.
All right. Hello, everyone, and welcome to the set of The Mediocre Dentist. I am your host, Dr. David Galler.
And I'm your co-host, Dr. Andrea Dernisky.
All right. Today is a fun one. Today is a fun episode. Today's episode is called The Top 10 Oh Shit Moments While You're in the Chair. That's today's program. All right. Well, for our audience out there, Malcolm Gladwell has a principle. We know we're big Malcolm Gladwell fans on this show. He has a very famous principle that says if you do 10,000 hours of any one activity, you are considered an expert.
Okay, you've mastered it. Okay.
If you spent 10,000 hours shooting foul shots in basketball, after 10,000 hours, you're an expert. You're one of the best people in the world at shooting foul shots. Okay. What do you think about that?
Yeah, I don't know. I think anyone who dedicates himself enough to anything is probably going to have good outcomes. I don't know that everyone just has that basic capability. Even if you do it 10,000 times, I don't know. I'm just trying to think of some athlete.
10,000 times. If you just started shooting foul shots, okay, in basketball, yes. 10,000 hours is 8 to 5.
Yes, I think you're definitely better. You're 100. You are better.
8 to 5 every day.
Okay.
For 5 years.
Yes.
That means you woke up in the morning, got breakfast, got a coffee. Yes. Went to the basketball court. 8 o'clock started shooting.
What a life.
Till 12 o'clock. Yeah. 12 o'clock to 1 o'clock lunch, and then 1 o'clock to 5 o'clock. You're just shooting again. You did that. No breaks, no vacations for 5 years.
I think you hate it at the end of that. I think you hate it at the end of that, man. I don't know. You would have probably been, you would have been able to adjust whatever your stance was. You would have been able to figure out what was going right, wrong, master it. Yeah, I believe that you get better. Is everyone become an absolute master or expert, or is someone ready for the NBA? Jury's out for me on that one. Really? I do. I love Malcolm. I love everything that he says. There's always great logic and theories behind it. I don't know. I'm right now, in my head.
You yourself. It's 2025. If you from today till 2030 just shot foul shots 8 to 5, Monday to Friday, 40 hours a week, 50 weeks, you don't think in 2030 you could shoot a same percentage as an NBA player of a foul shot?
I don't know. I've never done something like this before. But what I'm thinking about right now, if we're going to go back to dental for a hot minute, is when after I graduated, I came back to the school and I was working with some of I think the third year students. And some people just do not have good eye-hand coordination. And there's this one guy, and it was honestly like he was having an epileptic seizure while he was making his preps. I don't know that 10,000 hours in dentistry that he is going to be able to master the mouth. I don't know.
So, but that's the thought, is that if you do a certain amount, the training is set up.
Yes.
That, let's go through the training of drilling on teeth.
Okay.
So it starts with pre-clinic.
Pre-clinic.
You're drilling on plastic teeth.
Yes.
And the first couple are ugly. The first couple for me were ugly. We're ugly. We're straight up just, that doesn't look right. You're saying right away your golden hands were looking good?
They were looking bad.
God, I hate you so much.
I know, it's okay. All right, I'll take it. But
did you feel hate from the other students?
No.
Because
they weren't looking at my plastic teeth. I wasn't showing off.
Hate you.
No, I wasn't showing off my plastic teeth. I was saving that for the instructors. Yeah.
You were getting checked off first.
I got into clinic early, but I wasn't having a ton of problems with that. And I understand everyone's got their things. And there's plenty of things in dentistry I suck at. Don't even get me started on root canals.
What about the first time you looked in a mirror and you were doing drilling off a mirror? Right is left, left is right, up is down, down is up.
Yeah, that was wild. Yeah.
That was crazy.
That was humbling.
I felt handicapped.
I'm Michelangelo now. And I felt like everything was topsy-turvy. That was a bad day.
There was a time in my career where I thought I was going to open up a practice just for lower teeth.
Yeah, direct vision for the win.
I was going to be like, this upper teeth thing's not working. So
I know.
It's going to be Dr. David Galler. If you have a problem on a lower tooth, I'm good.
Oh, I thought I had mastered it until I got new loops, the ergo loops, because I wanted to save my back. And it was like going back. I don't know. There's something about it with posturing or whatnot. It felt like everything was off by about 45 degrees. And I'm like, here we go again. I'm 43. I can't do this. Too old for this shit.
So you start with the plastic teeth.
Yes.
Put in, I don't know, 300-400 hours there.
Yeah.
Then we go to pre-clinic. We're working under the guise of an instructor with obviously patients that are more understanding than normal because they're not paying a lot.
Yeah.
Another 1,000 hours maybe there.
I don't think that it was 1,000.
Really?
No, not in our school. I told you, man, we didn't even get in there to like I wasn't touching a live human patient until, and I was one of the early ones in, well into third year.
See, like right away,
I know.
At Penn, August, third year, boom, they're like,
I know.
These patients are paging you, they'd like their fillings. And I'm like, giddy up, here we go.
As it should be. I mean, it's one of the most important skills, and you better get your whatever hours you're banking with it, whatever your program allows, you better maximize that.
All right, plastic teeth, clinic teeth.
Yes.
Then I did a residency at the Brooklyn VA. So we got in, patients weren't paying for anything.
Yeah.
Patients, all these vets would sit down and be like, MOD, crown, root canal, crown, like we're 1 or 2 implants. And we were like, so those skills are just building, repeating, getting close to that 10,000 hours so that you get out and you're ready to go.
Okay. Now, do you feel like you hit a ceiling? My point with the Malcolm thing is I think that people have a ceiling, like the maximum point that they can reach. They're not getting past. Meaning I don't care how many hours David Galler puts into his clinical preps. You and I are going to land at different points.
Oh, yeah, no. David Galler is never going to have the crown margin skills that you have and the veneer
Well, that's what I mean with that
NBA.
Has. So like I could take all the foul shots in the world, my percentage, I don't know that I'm hitting ever at any point in time, even if I dedicated my whole life to it, which I never would. I don't know that I'm getting NBA stats.
But what's the NBA average foul shots?
Ooh, I don't know that.
Should I make up a number
75,
or should we ask
85?
Sean, our producer?
Okay.
Sean, our producer, what is the average NBA foul shooting percentage? Because last week we learned that David Galler likes to make up facts on the spot, which is not good for our overall long-term success. So now when David Galler is not sure about a fact, we're going to ask
Sean,
the producer.
Let's ask the professional.
It says as of April 2024, the NBA league average free throw percentage was 78.4%.
78. Okay. All right.
Can you beat 70? We have a son who beats 78% now.
I know, and he has. He's put in the hours, so he would, by all accounts, fit into the Malcolm Gladwell.
I think if you did 10,000 hours, I'm not saying you're 100% or 98% or setting a record.
Yes.
I think you could do 78%. I think I could do 78%.
I agree with the shooting. Let's take it to another level. Just like the actual game, like maneuvering, play making, etc. I could do that for the rest of my life, and I am never going to get. So
yes.
Yeah.
But I'm talking about a solitary skill that doesn't require any athleticism and height and coaching and team. There's so many variables.
Then we're on the same page then. Okay.
Like 10,000 hours of you making pottery.
Yeah.
I think you could teach a pottery class.
By the end of it.
Yeah. I'm not saying your stuff is selling at the MoMA, you know.
At the which?
The MoMA.
The MoMA.
MoMA.
Did you just make that up? What the hell is a MoMA?
MoMA?
MoMA.
The Museum of Modern Art.
Oh.
Have you never heard of the MoMA?
I'm very averse to acronyms. I hate all acronyms. It's like a triggering thing for me.
That's like a New York City thing.
No. You don't like airway people. You know how airway people always use acronyms? They don't even actually speak in English just to make us all feel stupid and mediocre. You MoMA'd me, and I was immediately in an airway chat, and I'm pissed off.
Do you think I dropped that acronym just to make you feel stupid?
I don't know that you didn't do that.
Maybe I did.
You were definitely trying to sound fancy, and I did not appreciate it. Is this in New York? Where is this? Is this from your home and native land?
Okay, so here's something our listeners should know. When we go on vacation, Andrea doesn't like to go to museums or really go see things.
That's not true. I like getting a taste of a culture. I like enjoying their food. Yeah, I love food.
I know, but that's not like culture of the
city. That is an aspect. We're using culture, and it doesn't feel dirty. This is the proper use of the word culture, just in case anyone's paying attention or watched a previous episode.
I think you could teach a pottery class with 10,000 hours.
I do think
pottery.
that, but I do think that there's some poor dental students, and they're already like $100,000 in, and they're in debt, and their hands are never going to be able to do this right, and it's not safe for patients.
Ever going to do it right, or never going to do it to the level of?
No, I'm saying even clinically acceptable. I know kids that they weren't even given the opportunity to get 10,000 hours in because it was so wild. It was I don't even know what it was, but it was not going in a good direction.
We talked about like the 10-80-10 rule in dentistry.
Yeah. Yes.
10% of dentists just works of art.
Yeah.
Work of art.
So long.
Dr. Appa.
Yeah.
Work of art. Some of your work of art. Some classmates that I lent, just work of art. I can work all day long. Yeah. I can get close, but I'm never going to do a BioClear the way you do it. It's just a skill. Yeah. Then I think 80% of people start off at whatever level and get to X level.
Yeah.
After a certain amount of hours, 10,000, 5,000, but everybody gets to clinically acceptable, nice level, contacts are good, margins are closed, everything's even, bite is good. And then you got 10% of people, it's just not going to come. It's just never going to come.
So it's not going to come. Okay,
but that's a very small percentage. That's only 10%.
It is a small percentage, but then they really don't fit within that Malcolm Gladwell principle then. That's what I'm saying. I'm saying that there are certain things.
They do the 10,000
hours. They do the 10,000. There's just something, like, I don't know if it's neurological. I have no idea if there's some disconnect between hand, brain, whatever it is. Not for every skill will this pan out. That's all I'm saying. There's exceptions to the rule. I believe with the basketball shooting thing, yes, we could get close to that 78 or 79% after 10,000 hours, but there are some things, and maybe it's just really complex. Maybe what we do, it's like at a microscopic level, more or less, or it's very small and it's hard to do, and it's just I don't know that everyone can learn it.
I think for those 10%,
yeah,
they get so discouraged.
Yes.
/ so nervous / it's not going well /
patients aren't happy. Or the instructors are awful to them.
Yes.
Yeah, that's a lot to handle.
That I think that 10%, they never get to the 10,000 hours.
It's possible. I'm telling you that. I don't think that they let them. they're like, you got to leave this program.
Or they come out into practice and then they find something else to do within the practice. They're doing Invisalign. Maybe they're doing whitening. Maybe they're doing
or they go
Botox,
into radiology or something.
Maybe they go into oral medicine. Maybe they go into teaching. Maybe they go into consulting. Maybe they work for an insurance company.
Agreed.
So I don't think I like to go to sleep thinking that all the dentists who are practicing full time are in that 80%. And that 10% who just can't get the hand skills, I think they would have gone had they stuck with it.
Yep.
10,000 hours. 10,000 hours is a long time.
10,000 hours is a lot of time.
5 years, full time, 8 to 4. I think they drop out along the way and position themselves into something else, and that's what they're never going. But today's episode is about those 80% in the middle.
Okay.
Those 80%
I'm with you.
In the middle
Yes.
who put in the hours,
Yes.
are clinically acceptable, but still have the oh shit.
Yeah.
All right. I want to read you the top 10 oh shit moments that can happen. I have a list of 12, and you're going to rank them for me. We'll talk about each one, and then you're going to rank them. Number one,
like
worst
what's the most
thing that
triggering?
can happen.
Okay. Yeah.
10, like the 10th worst thing that can happen. Still on the list, but you're not knowing. And our listeners will write in to themediocredentist@gmail.com or comment on our Instagram or YouTube page if any of these top 10 have happened to you and what you consider to be the top 10. We're voting for the top 10, top 3. Send us your top 3 out of my list. All right, I'm going to feed you top 10 worst things that can happen in no order. Okay. Number 1 on my list, but not order. This is not in the order that I want. You're going to rank these for me in the order.
Okay.
Number 1, you give an infiltration injection to number 16, number 3 in English. And you give the injection, and 2 seconds after you give the injection, the patient goes, I can't see through my right eye.
Oh, okay.
I'm blind.
Okay, well, yeah, no, I'm terrified because I didn't know that was on the table.
Yeah, that's on the table.
Actual
like you can
blindness
inject here, and it travels up, hits the optic nerve, and
hits
good
the
night.
optic nerve.
Okay, maybe not.
You are way too bloody deep, sir.
No, I have. Something happens.
Are you asking for a friend, or did this happen to you? What did you do? Did you pierce into their brain?
No, I've heard it can happen. It's very rare.
Can I modify this to what is actually on the table? Yes. Okay, you can get some of the nerves that are supplying the musculature around the eye, and it could become hard for them to actually close their eye, and you might have to put a little patch there, or they're going to dry out. That I have inadvertently had happen, and I'm sure I'm not the
eye stays open.
Eye stays open. You like pretty much paralyzed the.
I haven't heard that.
Muscle versus sensory.
Is that possible?
That is possible, but the blindness, it happened to me.
That a patient couldn't close their eye?
They couldn't close their eye for the duration of the anesthetic. Yeah, it's terrifying. You feel like a real major asshole.
I have heard people who've given injections and they can't see.
Can't see. I think that...
Like they have temporary blindness.
Okay, temporary blindness, you hitting an optic nerve. I don't buy any of this shit. I'm going to need Sean or somebody's going to need to fact check this because now I'm terrified that that's even on the table.
Okay. What about,
this is my number 1. If this is what it is, like number 1.
Okay. What about you gave an injection and like they got Bell's palsy?
Well, what? Okay, again, it's not Bell's palsy. It's something that's going to last longer than the duration.
No, like a Bell palsy type effect.
Oh, yeah. No, man, I get that one. Yeah.
Can that happen?
Yeah.
What about
again? That's when you're getting the muscles versus sensory. People have different hardwiring. Sometimes you're like when I do a gates, like all sorts of crazy.
Imagine like
happens.
You gave an injection to me, and I'm like, "Is this gonna hurt?" You're like, "No," and I'm like, "Okay." And
full
then
droop.
You go to do an exam, and when you come back, I'm like,
"Yeah, oh, I know." Well, you can't even do it. Yeah, no.
What's your face going?
No, I don't.
Do you think I'm no?
I do not like that one, but can I say the one that actually spooks me the most? Where they get the white patch where you know you got vascularity and it goes down and then there's just like that patch on their face that becomes like almost like death. Like it's like bright white.
Like here on the outside.
Oh, I don't like that one. I cover it because I can't.
Has that ever happened?
Yes.
What about like you gave it and like their face? You ever see their face blow up like to 3 times the size?
I know that can happen. I have not had someone have that effect. Is that when you're going too far back, like with the PSA, and then you're gonna get into the plexus? And yes, that's a big problem. You got to like medically.
What about you gave an inferior alveolar and they're like, I can't feel. You gave an inferior alveolar and they're like, I can't feel my hand.
Okay, again, yeah, we're going one on this, and these things aren't possible. So thank God for that, because I would not be in this.
So
this one
A.
So
we're
far,
gonna call it A because we don't have ranking. I don't want to rank it till the end. So A is injection given, something crazy happens outside of the norm. Weird
outside
swelling,
of the norm.
eye
Okay,
can't close,
I don't like
palsy,
this one. I don't like it because I can visually see what's going on and it's happening in real time, and I haven't even done the procedure yet, and I'm already spooked. I don't like it.
Are you saying, oh shit?
I'm saying, oh shit, for sure.
Oh shit. Okay. B, on a regular filling, cut in your little box.
Yeah.
Is just one of those where the pulp horn's too high, a little bit outside of anatomy. In no world did you prepare the patient that this might be a root canal. You click, you chase a stain, next thing you know, is bleeding. Not like gushing, just like pinkish red coming through.
That one I don't feel so bad about anymore because I'm conservative. I feel pretty good about my control, my approach, and I'm definitely doing everything I can always to not get it. If it got there, that wasn't on me. The decay went there. I'm sorry, sir, madam, whatever. Yeah.
You're good. I probably fast
fresh out of school, I'm shitting my pants. 17 years out, I'm like, okay, this is on you. I didn't do this. I'm just here digging.
So that's low on your list.
That's very low.
Oh, me, that's high on my list.
That's high on your list.
That's me. I'm like, wow,
that's
David,
oh shit. You see pink, you see red. Does it like varying degrees? Like if it's just like a dot, you're like, eh.
Yeah, any amount of red showing on a prep that shouldn't be there, and I'm like, I should change the name of this practice to the mediocre dentist.
Yeah, I know. I'm with you. I don't like when you don't know if it's coming from like the gingival tissues. It's something that's deep, and you're like, what is it? I need to get that matrix on. Like I don't even know.
Like you don't even know.
I don't know.
Okay, so you see red. Bleeding.
Yeah.
Oh shit.
Oh shit.
Oh shit.
I just don't know how oh shit it is quite yet.
Yeah.
If it's the gingival tissues, I mean, some people.
No, it's not. Let's say you blow air and it's not the gingival tissue. You're using a rubber dam.
I do use rubber dam. I'm in Canada. I don't know. You Americans, you're hooligans. You go.
I have 10,000 hours, and therefore at hour 10,000, they're like, I don't think you need a rubber dam. That's for kids.
The chemicals, everything, the water, the tongue. The tongue is where you lose me. Like the tongue is annoying. Yeah. It's there, and the rubber dam helps just keep it like contained.
The rubber dam, just getting it on and the clip flying across the room. That's where you get me.
I have not seen that actually happen. It has happened in my career. It happens so infrequently that cannot be the reason why you're not doing this. Anyways, it's okay.
C.
Be lazy. Okay, this one I don't do root canals anymore because of this.
Doing a root canal, trying to be a hero.
Hate them. Nope.
Get to the bottom of the apex, but it go like the apex go wee, like that, and you're like, well, I'm trying because that roots grow wherever they want to go. Nerves do not grow in a perfect straight.
I understand. Not just that, but even within the canal systems. Yeah, I started seeing those CT scans and like those renderings. You know when they like break apart a tooth and they like followed all the different trajectories. I'm like, this is bullshit. We're not getting any of this. I don't buy that the little shaky thing is like percolating the whatever, the bleach and all the things into it. Nope. I call bullshit. Breaking a file.
Breaking a file in a root. Oh shit or not.
So oh shit that I actually do not at this point in time do root canals. And I haven't had it happen often, but I hate root canals so much. The prospect of them, everything about them is oh shit, fuck this shit, not doing it.
Yeah, I have broken a file or two. I think I have broken 3 files in teeth.
Yeah.
Doing root canals. My last one was 2008, and I was like, I'm done with this.
Yeah.
And it's funny because when I graduated,
you loved them?
I was using rotary early on, and nobody else was in general practice. And I was like, I think I'm just going to jump from general practice, doing endo with my rotary because I was early on onto the rotary.
Yeah, no, I hear you. And I wanted to get there, and it seemed like such a beautiful thing, digging in the dark. But nope, not for me.
I have broken files. So how many files have you broken in roots?
I know that I've broken 1, maybe 2. I got out of doing these
I
so
think I
early.
did 3.
I spooked
I was
myself.
not able to get the file back out.
No, it's there, and I was like, maybe this is the best observation I've ever done.
And you know what they say on Dental Town? Get it out, just do this, do that. Nothing to get it out. Nothing.
No.
Here's how I get it out.
And that conversation that you have to have, like, with the patient, that, like, hey,
I broke a file in your, it sounds like I left a staple in your appendix.
Exactly.
I was removing your appendix and I left a staple there.
And fingers crossed. Like, it's already a fingers crossed procedure in my mind. And it's like, yeah, you throw that into the mix.
Do you want to know something funny? I early on did a root canal in my home office on one of my friends, actually a lawyer.
Ooh.
And he was a friend of mine. And I did it, and whatever. It was down to the apex, so the file's at the apex. And to this day, he reminds me of it. Hey, remember when you broke a file in my tooth? I'm like, you didn't even know the word file before I started. I don't even know why I said anything. Your tooth's fine. It's 20 years later. There's no infection. There's no anything. But you constantly remind me of it as if I owe you like $500,000 in lawsuit.
Well, how very lawyer of him.
All right. Broke a file, C. So we have injection causing weird is A. B, pulp exposure. C, break a file. D, you decide you're going to be a hero and you're like, wisdom tooth, I'll take you out. You're not even erupted. I'll take you out. Funny looking roots that I can't even see on my Panorex because everything's blurry on my Panorex. I'll take you out. Elevate, get in there. Upside down, upper wisdom tooth.
Ooh, upper.
Crack a root.
Yeah. Sinus is right there.
Sinus right there. Little guy just hanging out there. Okay, so you take out the tooth. You hear kick. Tooth comes out. You look at the roots, 1, 2, and then the third one's missing.
You can see it's like got that like oblique cut.
Sheared off.
That's an oh shit.
She's digging it. Oh shit.
Oh shit. Oh shit. Because sinus, I'm poking things into it. I mean, yeah.
Oh shit.
Oh shit.
You digging for it, or leave it as is?
I'm going.
You're going in.
I'm going in because, I mean, at this stage of the game, I feel like I have enough surgical experience that I can get myself out of a mess, most likely, but I'm not feeling good about the situation.
You're oh shit.
I'm oh shit, and I'm mad at myself that maybe I just
should have elevated more.
A little bit. Yep. went
the
too
elevating
close to the
seesaw, right? The more you elevate, the easier it becomes. But at a certain point where you're like, I've elevated enough. I'm ready to go to town, right? And then like you go in there. If you get it out without it, you feel like a king.
You do.
Queen.
Oh, I know.
When that tooth comes out with basic elevation, you're like, man, I'm talented.
Yeah. I think, you know what? I think I'm more oh shit now that I think about it. It's upper wisdom tooth that you get some of that like hamular notch. Like you're getting distal bone. Like this thing is just, it's like they've
got
like
no
bone
in there and like you're like, I could pop this sinus in a heartbeat.
Oh,
I could push this root right into the
whenever
sinus.
you see, I'm terrified about all of that and the implications. That's you're setting a patient up for a long recovery potentially and additional procedures. And I'm seeing my entire career flash before my eyes. Yeah.
They call like next week and they're like, is it okay that I'm bleeding through my eye?
Yeah. Okay. Well, that again got a little touch dramatic, but
Wisdom
this is oh
wisdom
shit.
Tooth root.
This is an oh shit situation.
You take out the tooth, you see sheared, clear little root left over there.
Yep.
And now you got to dig for it, and it's so tiny
and
that
it's
you're
bleeding,
drilling. You're not even
and
sure
it's so dark, and it's hard to see back there. Patients moving,
and you're
they're
late.
uncomfortable.
Exam, Dr. Dernisky.
Yeah, I know all of that. Yep, major oh shit.
All right, so E, you are placing an implant. We know you have implant training now through the Resnick program. You're loving it. You're learning how to do more sophisticated surgeries and procedures. You're up in placing an implant. You've kind of pushed up the sinus a little bit. You're packing it. And then you hear the and that little bag just goes. You pop the sinus. Oh shit.
What little bag?
The little sinus, the little baggy thing. Looks like a little bag. Looks like a little air bubble.
Are you talking about like what a sinus looks like? Like if you're I am trying to imagine what you're visualizing right now.
Yeah, I've seen sinuses. It looks like a little bag.
I've actually bumped up sinuses. I've manipulated
it looks like a little balloon.
But there's no like, it's not like popping a balloon. That's not how it sounds. There's no sound. There's not you can feel when you go into like the floor.
Yeah.
Of the sinus.
What happens when it pops? What, it doesn't go.
No, it sure doesn't.
What happens?
It just, you feel it break through, and then you're like, okay, I have arrived.
No. I'm talking when the sinus pops, like you've broken the air
There's
pocket.
no, you will know that you have perforated if you can, like sometimes you'll see some bubbling, things of this nature, but I have never, I did not
so
know.
You haven't seen that. So I have seen,
A
I have
sinus
assisted
pop.
on surgery. Yeah, I have assisted on, in my residency, I assisted on a surgery where he removed the wall, took it off, and I saw the little bag.
Oh, we're talking about a lateral. You made it seem like we're sticking in an implant. We're like
No.
crest.
You're looking at it. We see the little bubble, and you just have to like slowly lift it.
Okay. Yes. Exactly. Okay. This is a lateral approach.
Yeah.
Yes, I understand.
So you
and you
slowly
could
lift it. And then I was like,
Yes.
ooh, this is really cool. I'm going to help out. And I took the surgical suction, put it right up against the wall to help my surgeon. And
I'm going to be sick.
Popped the sinus.
Oh.
Popped it right open. And
that's like a major deal. You did not hear it do that.
In my head, that's what it sounded like.
I'm never going to sleep again.
Yeah.
That's okay. Well,
first it's like a little ball. You can pop it. You're like, ooh, do. And then you're like, ooh, there's a little hole. And the whole thing just shrivels up. It's not the craziest thing. You just pack it and it repopulates itself. But it's
it repopulates itself. I am so happy on behalf of all the peoples of the world that received surgery, and specifically a lateral sinus lift, that you have never actually performed that procedure. That was absolute wild account of something, and I am actually emotionally traumatized.
I think you're going to be a little nervous next time you see a sinus to know that that's on the table.
Everyone is nervous every single time they see a sinus, but it is not something that you can just be like, just pack it in and everything's good. No, you have a breach. You're gonna pack bone in there. You're just gonna hope for the best. It's not like there.
It's like a tire. It re-goes. Yeah.
I want you to never talk about a sinus again. You're banished.
All right.
Okay.
This is actually my number one. Oh,
this
shit
is number
moment.
one.
It is.
It's annoying.
Got the temporary crown on.
Yep.
And it's a premolar. There was a lot of decay. It was a lateral canine, a premolar. There was a lot of decay, so I had to prep a lot.
Prep a lot.
I had to
build
prep
up
a lot
because
you want to get the decay out in the prep. You can't have a prep that has decay, despite what our associates do.
I know.
Despite
all.
what younger dentists do. You
so
cannot
lazy.
have decay in your prep, and it's really hard to put composite or fillings or core into your prep.
Yes.
Like sideways-ish. It's not going to stay.
It's not just that. When you have fresh composite or whatever kind of material you're using as for your core material, when you put that temporary on, those materials like each other enough, they become one.
Hello, friends.
Hi, friend. Yeah.
So you have what would be considered a little bit of a Statue of Liberty, Eiffel Tower looking prep. And you put a temporary crown on it because you're a human and this person has to go back out into the world and this tooth is very much alive and kicking.
Yeah.
And then they come back and you're like, time to remove the temporary crown. And you grab this thing, whatever this thing is called.
There's different.
And I'm like, cool.
I don't call anything by its proper name. You need to know that about me.
Okay.
I would call it pointy
crown
thing.
remove. Pointy thing?
Pointy thing.
Give me the pointy thing.
Give me the pointy thing. Yeah.
I call it crown remover, let's say.
Okay.
And I grab onto the crown.
Why are you doing that if you know that something's suspect underneath?
How much are you going to get the crown off?
I'm going to make strategic cuts into it. And I'm gonna, I don't mess around. If I know
making strategic cuts in the temporary crown to get it off.
I'm going
like
buckle to palatal. Like a nice, thin, well-controlled, just get into the prep, just so you can see the cement.
I wouldn't know where the temporary prep ends and where the prep is.
That's what I use I try to use the white temporary cement so you can really see it.
I can't see that well.
You can't see that well.
I just go and I wouldn't know when to stop.
Wow.
Because I didn't use a ton of cement. Because if you use a ton of cement, then you grab onto it and you're like, please God, let me take this off. And you like, and then you pull. And now you just see a stump.
Yeah,
are you even talking about this makes me nervous.
I know. Yeah, I've been there, and that's I think why I took a step back, and I very rarely will use the pointy thing.
Because if the prep comes off in the temporary crown, That's oh shit for me.
That's oh shit.
I would like to quote our good friend April Kern.
Yeah.
Oh shit. I have fucked this tooth. I've fucked this patient's whole life my whole life. Thank you, April Kern, for that. I have fucked his whole life because I broke this prep off and probably fucked my own life too.
Are you going to still, your follow-up question, are you going to still proceed with cementing that final crown?
Oh, onto the stump?
Yeah.
Onto the stump.
Fingers crossed? Say a prayer?
I love that. No, I probably don't do that. What I do is I'll put like a little, post into what's left, build up something shitty little on top of it, and then cement the crown on top of that fake, not fitting core.
You would do that?
Better than just cementing it right on the stump.
Huh.
I'd build a fake core that I know does not match the interior of the crown.
That's
but
going to
at least
be
looks something.
It looks like something. You think that anything's sealing there? Okay, all right. I think it's
I didn't say
that
it
is a
works.
first. I mean, why put in all that extra effort?
But because Stumpy's not holding nobody.
You think it's got nothing? Okay,
Stumpy's
I'm imagining
holding
like you've got like at least a little bit of something somewhere that it's grabbing onto, and the
we
rest is getting filled with cement. That became your new core. No?
Okay.
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 I'm not doing any of those things at this stage of the game. But that's an oh shit moment.
I'm stressed enough. This is enough for one episode for me.
You're done.
I am
You're
stressed
tapping
enough
out.
Talking about oh shit moments.
My armpits are sweating.
I'm like a nervous Nelly now, and I'm not even seeing patients this week.
Okay.
I'm teaching all this week, and all these oh shit moments have me sweating. Do I look like I'm sweating?
You do.
Is it hot in this studio?
I see your pits.
I'm sweating. I can't even think straight. Like I'm nervous as hell. Why are we in this profession?
I have no idea. I am never going to sleep again.
I'm never going to sleep.
Causing blindness?
I think you should.
I didn't know I was so deep.
I think you should call every patient from last week and find out if they're blind or not.
I'm going to be warning them come Monday morning. Hey, did you know this was on the table? Like, proceed with caution.
Let's be real. Let's be real. Despite 10,000 hours of training, oh shit moments happen in dentistry.
Let's be real. The mouth is a pretty savage place. It's pretty impressive that we don't have more oh shit moments.
Let's be real. Every dentist, no matter where they've been trained, how long they've been practicing, has oh shit moments that just make your armpits sweat and a little bead of sweat goes down your back in the middle of the procedure.
Let's be real. I'm not going to sleep again. Knowing that blindness is on the table, some of these things you were saying, I hadn't even thought before.
Let's be real. We both don't like doing root canals.
Let's be real. Keeping dead things in a body is pretty weird.
Like dead teeth, right?
Like dead teeth. It's not for me. Yeah. Hard no.
Yeah, like get it out.
Yeah. Bye.
Yeah.
What other dead things do we keep in our body?
Right. Yeah,
I've never understood it.
Or have an infection in it.
Yeah.
Just
bye.
Get rid of it.
Gone. We got implants.
Let's be real. David is not cleared to do sinus lifts.
Let's be real. You should never even be allowed to say the word sinus again.
Yeah. Let's be real. Okay, so let's wrap this episode, which has gone longer than we thought, but it
got a little off track.
Yeah, we got off. Well, it has brought up so much anxiety that I think we both need this as therapy. So we're going to break this into 2 episodes, but this is the episode called Oh Shit. Now, the key was that despite the fact that most of us have 10,000 hours of experience, which is Malcolm Gladwell's golden rule, which makes us an expert, even though we have those 10,000 hours of experience, there are still oh shit things that happen 17 years in.
Absolutely.
And we've gone through a few. Let's go through the 6 that we went through. Giving an injection that causes something weird.
Yeah.
Would you say that is?
That's oh shit.
Oh shit.
Oh shit.
Pulp exposure on a routine procedure.
Expected. Not gonna trigger
For
too
me,
much.
oh shit. I'm a mediocre dentist. Breaking a file during a root canal.
I do not have to think about this anymore on account of I stopped doing them.
But if you did do a root canal,
if I did,
you had to do
massive
one.
oh shit.
Massive oh shit. Have you ever done the thing where you put the files next to each other?
Oh,
like
to see if you lost length? Oh, yeah.
You put the normal one next to the regular one to see if one's longer than the
No,
Other-
I actually, when it happened once, I like adjusted the, the little stopper.
Yeah.
I was like, oh, you must be wrong. Let's just move you up a little bit. Yeah, no, we're the right length.
Oh shit.
Nothing to say
Crack a
here.
root on an upper wisdom tooth.
Yeah.
Oh shit.
Oh shit. Big oh shit.
Uh,
Sinus is right there. And then popping into a sinus,
David
deflating it
Galler-
like a balloon.
David Galler popping your sinus
Ew.
with my surgical suction.
I don't know what kind of air pressure was generated in that sinus,
Yeah.
but there was something very wrong with that sinus.
That's oh shit, right though?
That's an oh shit. I don't, yeah. No one wants to see
And
a
David
sinus.
Galler's personal worst, crack a prep in a crown.
Yeah.
Uh,
It's a lot of tough decisions to make once that happens. And a
there's
lot of
no shit
awkward
moments.
conversation.
Maybe we'll discuss why it happens in another episode, but for this episode, that's enough oh shit for today.
Yeah.
Like, we're only two human beings.
I need to book my appointment with my psychologist. Discuss the trauma.
The mediocre dentist, the mediocre dentist. Cause sometimes you just feel mediocre. The mediocre dentist, the mediocre dentist. I am mediocre, you are mediocre, and that's not that bad.